So, this is coming from organs or tissue from living patients. We will collect this amount of tissue from the patient and then we will send it to the laboratory for tissue processing or biopsy. So, there are two major types of specimens submitted for surgical pathology, and these are biopsies and surgical resections. Itong biopsy is a small sample of tissue na kinukuha primarily for surgical pathology analysis and most frequently to provide a conclusive diagnosis. So, surgical pathology can be obtained from any part of the body. Examples, from palpable lumps like our breast, lymph nodes, soft tissue masses, and thyroid. From any visceral organs like our stomach, intestinal tract, liver, lungs, and abdominal cavity, cervix, and kidney. We can also get it from our head, neck, and our brain, from our superficial tissues like oral cavity, skin, eyes, nose, and ears. So the main purpose of the surgical pathology is to diagnose the disease like inflammatory lesions or neoplastic, kung benign ba or malignant, which is na differentiate naman ng previous supporter natin. So, there are 5 types of surgical biopsy which are incisional, excisional, punch, needle, and curettage. So, pag sinabing incisional, when a piece of tumor is taken from a patient for diagnosis, and excisional naman removes the entire tumor and sends it to surgical surgery for diagnosis. Pag sinabing punch naman, when a cervix biopsy is performed and a needle biopsy is for bone marrow sampling, and the last one is curettage, which when the endometrium biopsy is taken. Next slide, please. Let's move on to the second kind of histopathological specimen, which is the cytopathology specimen. This is body fluids from living patient. It is a diagnostic technique that examines cells that have been exfoliated or shred, scraped from the body, or aspirated with a fine needle. So, cytology test may be used for diagnosis or for screening. Kapag sinabi nating diagnostic test, sinasagawa lang ito sa mga patient natin or taong may signs, symptoms, or other reasons to suspect na meron siyang specific disease like cancer. Itong diagnostic test is nagde-determine whether nag-i-exist ba yung disease or hindi, or kung nag-i-exist man, maka-classify natin kung ano ito ng accurate and precise. So, when we say screening test naman, ginagamit naman to para ma-identify ng tao or patient, ma-identify ang tao or patients na mayroong disease before pa makita ang symptoms. So, itong screening test, expected natin na nagde-detect ng mga taong risk of having the disease, pero it is not always proved that the disease is present. Cytology test on body fluids. So, fluids taken from cavities in the body can be tested to see if cancer cells are present. Some of the body cavity fluid tested in this way include our urine, sputum or yung phlegma, spinal fluid also known as cerebrospinal fluid or CSF, pleural fluid from the space around the lungs, pericardial fluid from the sac that surrounds the heart, acidic fluid also called ascites or peritoneal fluid from the space in the belly. And the last one that we're going to talk about is, next slide. Autopsy or post-mortem specimen. So, an autopsy, also known as a post-mortem examination, is a specialist surgical procedure used to determine the cause and manner of death. The cause of death is the medical reason explaining why a patient passed. The manner of death is the circumstances surrounding the death. Post-mortem provide useful information about how, when, why someone died. Also, it enables pathology to obtain a better understanding of how diseases spread. It is a medical examination of a body and internal organs after a person has died. There are two types of autopsy: the coroner's autopsy and the hospital autopsy. A coroner autopsy is performed if the coroner or police need information for legal reasons about the cause of death. For example, if the person was murdered or their death was suspicious. Tulad nung nangyari kay Christine Dacera na isang flight attendant, unang report is rape daw, pero according to the autopsy report conducted by the coroner, Dacera died from ruptured aortic aneurysm. And the last type of autopsy is the hospital autopsy. A hospital or non-coronial autopsy may be performed if the immediate family give their consent. So, immediate family has the right to refuse or agree to a hospital autopsy of the deceased. So, in this case, the autopsy can help to clarify the reason why the person died or offer information to the medical profession on the deceased person's condition. Last slide, please. So, tissue samples from an autopsy. Tissue samples taken from the body are usually kept by the laboratory. The samples are kept in the hope that technological advances may one day answer any remaining questions about the cause of death or the nature of the disease. Keeping tissue samples requires the specific consent of the deceased next of kin. Organs that have been retained from the further testings are returned to the family. Disposed by the hospital are kept for future medical research and training of medical staff according to the family's wishes. So that's all for the kinds of histopathological specimen. Thank you.